Thanks, Ken. I'm Trina with Copeland Healthcare Center. I've met a lot of you, and really I just wanted to take this opportunity to say thank you for allowing us to be one of your sponsors. We started Copeland Healthcare here in Edmonton back in May 2012, and shortly thereafter, probably about October, we met with good old John Trapp and Kari Erickson, and they introduced us to EO, and we have happily been a sponsor of your membership ever since, and it's been a really great partnership. From our side of things, you maybe have seen a little bit of news last night on the news and in Edmonton Journal, and I think unfortunately we're getting pulled into the political posturing that's happening in my good old neighborhood of Old Riverbend with the White Mud by-election here coming up. Last week I had a doorbell ring at my home and opened the door to find the NDP candidate and former leader of the party there. And we had a lovely, lively conversation on the doorstep. And Dr. Bob Turner told me how we were so not very far apart and how we could work together. And then lo and behold, here we are on the news. So I guess from our side of things, we really hope that we're out there as a choice for people. We're not saying we're the only choice, we're just saying that we think that Albertans should have a choice, and that it really is about doing what's best for yourself. It's about prevention, and I urge you all, if you come to Copeland, that's great. If you don't, that's fine too, but really just take care of yourselves and be preventative. There's a couple stats that in the Canadian Institute of Health last year alone, of the deaths of people 75 years of age and under, 30% were from preventable causes. So if anything, just get your checkup. And we're happy to be a sponsor, happy that you allow us to come to these great events, and happy to sponsor Dr. Hrabok this morning. I'd like to turn things over to Kari now.
Really long walk up here. Copeland has been a great sponsor for EO, so thank you so much for being here today. Brain health has been kind of top of mind for me lately for a number of reasons. We are in the process of renegotiating our group plan at the dealership, and as has been the case over the last number of years, the biggest increase in the largest use of medication within our dealership is for mental health. And it always surprises me. I don't know why it should, but it always does. On top of that, I received a phone call yesterday from a friend who needed some help with her children because her husband was in dire straits and was being taken away in an ambulance for mental health reasons. And so it's kind of been top of mind for me, and whether it's watching your aging parents or dealing with anxiety yourself due to stress at your business, I think it's pretty topical and certainly not something that gets as much attention as it probably should, nor as much funding as it probably should. That's kind of my soapbox, but with that being said, I'd like to introduce Dr. Marianne Hrabok. She is a neuropsychologist with Copeland Health, and she's going to discuss brain health with us today. Thank you.
Can I get you to be my slide person? Actually?
Sure.
I'm just thinking it's a big room. I just had a quick question for you. Can I use that mic?
Yeah, of course.
With this? Okay,
Yeah.
okay. Hi everyone, it's a real pleasure to be here with you today talking about brain health. Can everyone hear me okay at the back? So? Okay, how about now?
Is there a handheld up there?
Pardon me?
Did they give you a handheld?
I don't see one, no.
I'll go check with the manager.
Okay, all right. So I'll do my best to be a little bit louder, and hopefully I'm projecting to the back. Okay, just let me know if you want anything repeated. Okay. Okay, so we can move on to the next slide, Ken, thank you. Okay, so I'm the neuropsychologist at Copeland Healthcare, and really what I'm here to talk to you today about is brain health. So typically, when people tend to consider health, we really tend to think of the neck down. But actually, you know, your brain plays a key role in absolutely everything you do, whether it's thinking, communicating, feeling, really with all activities. So it's a really important part, obviously, of health. And as Kari mentioned, it's also No handheld? Okay, all right. Okay, so I'll just do my best to be loud, guys, sorry. So really, when we're talking about brain health, like I said, we're talking about what the brain can do. So thinking, feeling, communicating. We're talking about executive functions as well. So those are things like problem solving, planning, creativity, that I'm sure all of you use on a day-to-day basis, not only in your day-to-day life, but also in your businesses as well. And so in recent years, there's been quite a bit more awareness about brain health, and that's spurred on in large part due to the Alzheimer's epidemic, that there's a lot more rates of diagnosis of Alzheimer's disease, and also increased awareness of the impact of sport-related concussions, I think, has also kind of made people a little bit more interested in brain health than previously. Okay, thank you. So really what this slide shows is basically how your health and wellness goals for your brain might change over time. So if you see on the x-axis there's the age, so 25, 50, 75, 100. And then on the y-axis there's performance. So your two goals that you might have for your brain health are to improve brain health, and secondarily to delay disease onset or delay the progression of disease once it's there. So really earlier in life, really what you're trying to do is improve your performance, improve your cognitive health. So, if you think about putting money away for retirement, you're building your bank. And in a similar way, what you're doing earlier in life with brain health is you're building your cognitive reserve to sustain you later on in life and help prevent the onset of memory problems. And then as you go on in time, what you're trying to do is delay the onset of disease or delay the progression of disease if it's there, such as Alzheimer's disease. Okay, so I'm just going to cut right to the chase and talk about what research has suggested are the top strategies that we can do today to improve our brain health. All right, so one of the biggest things, believe it or not, is exercise. So let me ask you, show of hands in the room here, how many of you get regular exercise on a weekly basis, meaning 3 to 4 times a week, 30 to 60 minutes? All right, wow, that's awesome. Good for you guys. So you're already doing something that's very key for your brain health. So what we know is that when we exercise our body, our brain actually benefits. So this has been shown in a lot of different ways. So one of the ways it's been shown kind of more in the short term is after a period of aerobic exercise, there's actually been improvements noted in cognition. So you're better able to pay attention, you're better able to focus. You might have an experience where, a problem that you've been mulling over in your head, kind of you get the solution after a good workout or whatever. And that's been borne out in research as well. Interestingly, if you can go back, sorry. Exercise has also been shown to increase brain volume, which is incredibly interesting and is actually a really new area of research. And the areas of the brain that has been shown to particularly benefit from exercise are those involved in memory and executive functions, so planning, problem solving, goal setting, those type of things. And those are actually also the brain areas that tend to show the most age-related decline. So really super interesting research coming out on that. And also, there's also been identified that exercise increases brain-derived neurotrophic factor, which is a neuronal growth factor that helps build new neurons, new nerve cells in the brain, new blood vessels, new connections between neurons. So very exciting there. Another really big, powerful way you can do to improve your brain health is actually target certain medical conditions. So these are also referred to as brain aging accelerators. So these are things like high blood pressure, diabetes, high cholesterol, obesity, and heart disease. And what these all have in common is they all impact the health of your blood vessels. So your brain is relatively a small organ in your body. So it's only about 3% of your body's weight, but your brain actually uses 20% of your body's oxygen supply. So I always say it's a greedy, very resource-intensive organ. So anything you can do to improve the health of your blood vessels will also improve the health of your brain. Finally, so a third thing here is diet. So eat brainy foods. So some of the foods there have been associated with brain health. So berries, almonds, the coffee bean, salmon, fatty fish. So what these things have in common is they're high in antioxidants and they have anti-inflammatory properties, which is really important for your brain health. So this is an example of a diet that's been associated with, excuse me, that's been associated with improved brain health. So this is a Mediterranean diet, and it's really an example of a plant-based diet. So what you can see on the bottom there, the biggest part of the pyramid, is fruits, veggies, grains, all those kind of foods that are very high in antioxidants, very high in anti-inflammatory properties. And then what you see going up the pyramid to the skinny part at the top is meats and sweets less often. And you'll also notice on the bottom of the slide there's a rainbow of different foods to eat. So this is quite contrasted to your typical Western diet that has an emphasis on meat and starches, for example, kind of flipping it and emphasizing really a rainbow of different fruits and veggies and whole grains and that type of thing. And so, instead of worrying about specific portions or how many of what I should get, so this is a really easy way to remember. So eat real food, eat fresh food, so eat like a bear, basically. And so this is an example of obviously the opposite of the Mediterranean diet. So you can see it's highly refined, highly processed. So these would not be good for your brain health. And another little saying, so if it came from a plant, eat it. If it was made in a plant, don't. It's a kind of snappy little phrase to easily remember stuff. Okay, so fourth thing that we can do to really improve our brain health is work out your brain. So really get out of your comfort zone. So really anything you can do that is going to be new to you, is going to be challenging, and is going to be varied, is going to help improve your cognitive health and keep you stimulated that way. So there are a number of different computer programs that have come out. You've probably seen commercials for them. Those do have research support, so that's one way of doing it for sure. But you don't necessarily have to do that. Take up a hobby that you haven't done before, or kind of get out there, do something new. And so as humans, what we do is we tend to select into things that we're good at, we've been doing for a long time, that are comfortable to us. And so to kind of shake things up is really good for your brain. So, if you watch a young child play, they pick up a stick and the stick becomes a car, the stick becomes a doll, the stick becomes a pencil. And we kind of lose that as we age, because part of the reason is that we tend to gravitate toward things that are comfortable for us. But our brain actually craves that stimulation and that novelty. So the opposite, and similar to exercising your body, when you exercise your brain, you need the counterpart of recharging your brain. Okay, so exercise is very powerful for stress management. It actually improves depressive symptoms as well in people who are suffering from depression. Getting outdoors, engaging in experiences rather than acquiring things. So you're more likely to recharge your batteries if you share an experience with someone than you are if you go out and buy something new. So finding a higher purpose as well. So spirituality, volunteerism, whatever that means to you. And then being around other people. So socializing is very key, and these things have been shown to relate to quality of life and satisfaction and psychological well-being. Meditation as well. So quick show of hands, how many people here meditate? That's great, yeah. So, this used to kind of be thought of as a little bit new agey and maybe kind of airy-fairy, but there's been some really interesting research that has shown that meditation is really good for our psychological health as well as for our brain health. So it really decreases stress and improves our ability to deal with life struggles. In terms of brain, the effects on brain health, there's been some really interesting research done using brain scans while people are meditating, showing that the networks of our brain that are responsible for, obsessively thinking about the past, the present, and the future, kind of ruminating on thoughts, are temporarily deactivated while we meditate. So it literally gives you, a real ability to kind of recharge and step out from the thoughts that we all have that kind of race through our minds on a continuous basis. So stress, how many of you have experienced, would you say, significant stress in the last year or so? Yeah, okay, yeah. And I mean, stress is such a common experience now, especially in our society. So, and if you raised your hand, you know, stress is not always a bad thing. So when I work with people at Copeman, I really try to talk about not so much decreasing stress, more managing stress. Because stress actually, a little bit of stress is good for us. It motivates us, it helps us achieve deadlines. But too much stress for too long of a time can actually cause mental, physical, emotional exhaustion. And, you know, a big question is, well, how do I know when I'm stressed? And oftentimes it's our loved ones actually that are better at pointing out, you know what, this is a little bit too much stress. You know, I've seen you stressed before, but this is a lot. So some of the other signs that you can kind of look for are, you know, feeling very overwhelmed by constant demands. Also a loss of motivation and interest. So things that used to really get you going, things that you used to love to do, you're just kind of blasé now and not as interested in. So those are some of the signs of burnout and chronic stress, really. Okay, so the next thing is prioritizing sleep. So I noticed that it says prioritizing sleep instead of, you know, get 9 hours a night, because unfortunately that's not realistic for most people. So really what we know about sleep is it improves our mood, it actually improves our ability to focus, it improves our cognitive skills, and there's been some recent research to suggest too that sleep disorders can actually be an early sign of memory problems, such as Alzheimer's disease. So really important to pay attention to sleep. Okay, so finally, another thing that is important to do is tracking your brain health. So, and this is something that Copeman is very innovative on. So this, as I said, brain health is more in people's consciousness and awareness. And you've probably all been for a physical, you're used to going to your doctor and getting, let's say, for example, a blood pressure test. So just because you're getting a blood pressure test doesn't mean you have high blood pressure. What your doctor's doing is he or she is getting a baseline for where you're at today, so they can track going forward in the future any problems that might arise with your blood pressure. And we do something similar at Copeman, which is a baseline brain health assessment. And so it's very short, it's about an hour of your time, and it's just good to get, you know, a snapshot of where you are today, so we can use it going forward as well, whether more tests are needed, or, you know, whether there's maybe some areas that are starting to show some difficulty, so we can implement a roadmap early on. And I often get this question, so if you or a loved one is experiencing memory problems, you know, what do I do? How do I go about that? So I would say first off, take these concerns seriously and get assessed, because if someone's noticing memory problems, there may be something going on. It might not even be memory, it might be attention, it might be something secondary to memory. And the point of getting assessed is really to get a roadmap, to get a plan for where to go forward. And we know that early intervention is really, really important. And this has only been something that has kind of recently come into focus of research. So, you know, dementia used to be viewed as a progressive illness, and, you know, there's not a ton we can do, and that's really changed a lot in the thought in the literature. And early intervention is key. And I just also wanted to really point out that memory problems aren't necessarily signs of brain disease or Alzheimer's. So when somebody tells me they have trouble remembering things, it's almost like someone saying they have a headache. So there's really a ton of different reasons why someone could be experiencing difficulties remembering. So other medical conditions can come into play, like thyroid difficulties. It can be secondary to medications. It can be secondary to stress. It can be secondary to sleep. So it's just good to get an initial assessment and see where things are at, so you know going forward what you can do. Okay, so who can tell me some of the steps to maximize brain health that I talked about?
Exercise.
Pardon me?
Exercise.
Yeah, excellent, yeah.
Do new things.
Yes, perfect.
Diet.
Yeah,
Don't meditate. That's
yeah, very good.
stress.
Yeah, awesome. Okay, you guys are listening, so I don't have to do this again. This is good. Okay. So get moving. Actively manage your medical risk factors. So those are those heart-related conditions I was talking about, like obesity, hypertension, high cholesterol, those type of things. Diet, exercise your brain, manage your stress level, And, you know, it says increase your enjoyment in life, because management of stress can be different things for different people, for sure. But that's really what you're going for, is to improve your quality of life, your enjoyment of life. Prioritize sleep and track brain health. And I just also wanted to just reiterate that, you know, many of the things that I've talked about here are all related to each other, and they actually mirror the model of care at Copeman. So Copeman's has 3 different pillars of health, so psychological health, brain health, and physical health. And as you've seen with the various strategies to maximize brain health, you can't really separate one out. They're all very interrelated, and I'd like to say at Copeman that I think we do a really good job of assessing all of those in a team-based environment. And that's it. Thank you very much. Yes.
Got a question back here.
Yeah.
The assessment part. I
Yeah.
have a father who I had some concern with, and I called our family GP in advance of him going for an annual physical to give him a heads up to look for things and ask him questions, whether it be depression or whatever, you know.
Mm-hmm.
And he called me back, the doctor, he's been our family doctor, and he goes, I think he's fine. And it was that was the end of that road, and I still, you know, not totally